Hello, my name is Dycelie Rivera. They call me Dee Dee here at Katallasso, and I am the director of the clinic. I've been here for 5.5 years, and we just celebrated our 8th anniversary. As we think about 8 years of Katallasso, I reflect on my own time here and some of the things that have changed and some of the things that have remained the same. We are faith-based and our values have not changed. We continue to serve the community that is uninsured or underinsured. We continue to offer our patients support, whether it's through prayer, through counseling, and just encouraging our patients to continue to take care of their health. We've served over 3,000 individuals in the time that we've been at Katallasso, and we're just so thankful to all of our supporters and everyone that has come alongside of us to make 8 years of successful serving patients that are uninsured and underinsured in the York County community. In the beginning, when I started working at Katallasso in 2015, we didn't have the availability to do as many labs. So we were limited in what kind of blood tests we could request for our patients. Whereas now, because WellSpan has come alongside of us and provides lab work and imaging at no cost to our patients, we are able to provide those services to our patients at the provider's discretion and not worry about the limitations. So we can provide lab works, whether basic or extensive if it's necessary, and imaging or ultrasounds if it's necessary. And that's something that I've definitely seen change. I just think about where we were before, trying to set a patient for x-rays to make sure that their arthritis was under control, and our patients were so nervous to do that, and thinking to this year that we can simply just send them to a WellSpan facility, and we're just very grateful. Continue to have great providers that volunteer at Katallasso. When I began, there was maybe 12 providers that were volunteering, and we're now at more than 25 providers and nurses that continue to serve our patients. We serve our patients in the time that they need. So if their appointment is 30 minutes, that's what it is. And if they need 45 minutes, that's what it takes. We have more patients, we have more providers, but we're not taking away from the patient care. We continue to take the time to really listen and focus and be able to help them through all their healthcare needs rather than rushing them through a 10 or 15-minute appointment. So when necessary, we continue to serve 30 minutes and 45 minutes, and that's a huge blessing. We are also Christ-centered, and that has not changed. We are faith-based, and that just means that we want to serve our community in the way that the Lord would serve, that would reflect His love. And so we continue to offer prayer for patients. Some things that I have heard throughout the years is that patients have offered to pray with some of our providers, and that's always beautiful to hear. So throughout the 5.5 years, we've grown. Our foundation has stayed the same, our values have stayed the same, our providers have grown, our services have grown, and I cannot wait to see what God has for us in the next 8 years.